Thank you, everyone, for attending a third in our series of the Florida Clinicians for Climate Action, collaborating with the Black Nurses Association. Tonight, we have Dr. Madison Miracle.
As many of you may know, the climate crisis has a lot of negative impacts on human health. And unfortunately, as an industry as a whole, the healthcare sector is a major contributor to this problem. The healthcare industry in the United States contributes to around 10% of US emissions. And this is greater than the entire United Kingdom combined because, we are contributors to this. That there are a lot of inherent, operational costs that cannot be ameliorated, but it also means that there are things that we can do to reduce these effects. And so the goal of this talk and presentation is centered around the role of a climate clinician. And really, what is a climate clinician? It's kind of a new term. It's not a specific, definite role yet, but it's something that is emerging, and really the field of climate medicine is an emerging field as well. So a climate clinician, I would say, is really anyone who works within the healthcare industry or is tied to the medical field in general and is aware of the negative impacts of the climate crisis on human health and wants to be involved in helping reduce that impact and achieve greater change. So the first level is the micro level, and this is really in relation to caring for individual patients. And so the first way we need to approach this is really to just educate ourselves and be aware of the negative impacts of climate change and how this actually affects our patients. And then the next kind of level in this framework is the meso level. So this is on the broader level of large hospitals and healthcare systems, like within buildings and facilities. This could be, in construction of new buildings, making sure that they are LEED certified. And then also this could incorporate retrofitting old buildings to make them more sustainable. And then along the supply chain, the supply chain is the greatest contributor to our emissions as a healthcare industry. Additionally, on the energy and transportation side, this could be, making sure that HVAC systems are up to date so that they're more efficient, and even like electrifying some of the fleets. So from EMS and ambulance vehicles. Some states have already started to implement electric vehicles and trial this process too. So when I first started residency, I did residency at Orlando Health, and as starting out as an EM intern, I knew that I wanted to somehow get involved in reduce missions and help our healthcare system however I could, but I didn't quite know what the best way to do that would be. So one of the ways that I did this was just by emailing the director of sustainability at Kaiser Permanente. So she's kind of like the CEO of sustainability over that whole corporation. And luckily, she graciously set up a Zoom meeting with me, and then I had a similar experience with Dr. Amy Collins, who heads up the organization Healthcare Without Harm, which you may or may not have heard of. They're kind of a third-party organization that helps address climate change and the climate crisis in relation to human health in general as well. And so the best advice that I received from both of them was that I really needed to go from the top down. And so the next step was trying to get in touch with our leadership at Orlando Health and find a sustainability champion within the C-suite. And then ultimately, we formed an environmental stewardship and sustainability committee within our organization, and now have many stakeholders from around the hospital, from waste management, buildings and facilities, and other areas to try and all collaborate on these efforts. And luckily have gotten some financial buy-in from our CFO, and most recently just joined Practice Green Health. Their logo is off to the side here. And then the last kind of area in this framework is getting involved on the macro level. And so if, the micro or meso levels don't really appeal to you, there are still other ways that you can help out in this effort. And so this could be, within academia. So getting involved in research or developing curriculum for medical students or nursing students in health professional schools. And then also getting involved either locally, regionally, or nationally on the political level by advocating for policy changes or creating op-eds, or just getting involved in other ways by lobbying, whatever is appealing to you. And it sounds like many of you are already involved within this organization, which is a great first step. And so really, how can you become a climate clinician? There are programs within, furthering your own education and continuing graduate medical education that are currently in development and have been developed that you can get involved with. There are many different ways to get involved, and so this can be by networking with other healthcare professionals. So that could be, through the FCCA or just locally with others within your organization or your local community, attending different conferences. Like you may have heard of Clean Med, which is a national conference specifically focused on healthcare sustainability, and then other national or local conferences, even COP, the international one, and then also, getting involved with different organizations like, the one you're currently involved with, Black Nurses Foundation, and then also FCCA, and then many other national groups related to the climate crisis. And so, with all of this, I hope that you can all feel empowered to remain hopeful and take action. And then, we can all kind of work together to achieve a better world.
Thank you, Dr. Miracle. That was wonderful.